Hello, everyone, and welcome to Biohackers Lab. I'm your host, Gary Cohen, and on today's episode, I have Dr. Philip Blair. Dr. Blair is a family physician and consultant in disease management for workers' insurance programs. He is also a retired U.S. Army colonel who was a combat physician in the Gulf War and retired after 29 years in uniform. Since 2014, Dr. Blair has been consulting, treating patients, and lecturing about CBD and how it can improve serious medical disorders. Philip, thanks so much for coming on to the episode today.
Hey, great to be here. Wonderful to be tapping into the UK and all of your affiliates and whoever you talk with.
I'm based on a little island called the Isle of Man, which is just off the UK. But I've got a lot of UK listeners, but also a lot of American listeners. So, we're transatlantic. We're going to cross, and even down in Australia and South Africa, there's a lot of different people who are going to listen to you today.
Well, I love to talk to those people as well. And part of my international consultancy on cannabidiol actually takes me to South Africa, Australia, and New Zealand, in addition to Japan and even Korea.
Wow. So, that's what we're talking about today, is why is CBD not being used more and more widely? And it's great to hear that, loads of countries and people around the world want to use it. So, I'm excited. I know you're super excited about CBD and all the other cannabinoids. So just sorry for listeners, I'm going to get a bit tongue-tied on that stuff today. But the reason just to give people a little bit of background, I recently just got a little tub of it myself, little spray to put under the tongue. And from there, I decided to sort of geek out more about it. And I got to watch the scientist documentary about how it was discovered, and the Dr. Mechoulam and the story that he goes through. And it's fascinating. And so to sort of get us into this for people who don't know anything about it, could you just explain what is CBD? What are we talking about?
Okay, but let me first say that I am a family physician primarily. That was my graduate training after medicine. So I did the whole 9 yards, delivered babies, did vasectomies, took care of infants, children, adults, geriatrics, the whole thing. And I practiced that for the entire time that I was in the military until I retired in 96. Then I started doing disease management starting in 2000. And then I'm trying to figure out mechanisms and ways to hack the body and trying to get the outcomes that we should be seeing from current medical therapy, but we're not really achieving those. And so that's part of my course and how I've been there. Now, moving back to cannabidiol, this is a substance, and it's commonly referred to as CBD, and it comes from hemp. Now, if we talk about the hemp plant or the cannabis plant, it's really of two varieties. On the one hand, you've got marijuana that contains THC. On the other hand, you've got the hemp, sometimes called industrial hemp, that doesn't contain any significant amount of THC, but it has most of the cannabidiol. So THC makes you high, CBD makes you healthy. And fundamentally, that is the principle that's behind it.
Okay. Yeah, so I think that's what I always like to just bring that up in the beginning, because it seems like that's the most common misconception, like myth breaking number one, is that it's not marijuana. So it's not the stuff that gets you high when you take the spray. So I can tell people, no, I didn't get high by spraying this stuff under my tongue. So you mentioned earlier there too about industrial hemp. Do we get different types of hemp then?
Well, there's several different species. They're not actually species. They're called cultivars. And we sometimes separate them into cannabis sativa or some of the other varieties, but and a lot of people will focus on that. I don't focus on that. The sativa is the most common variety and has the highest levels of cannabidiol. And there are cultivars that come from the industrial hemp or from the marijuana plant that provide different combinations of other substances, what Dr. Mechoulam calls the entourage. And these are also very important. There are the other cannabinoids that are in the plant. There's probably about 100 that are in just this plant alone. and there's many others that are found in nature. But there's also terpenes, and these are small fat molecules that have a different blend. Then the terpenes are the things that have strong odor that you encounter. So such as a pine scent or lemon or grapefruit. They actually are some of these compounds, these fragrant essential oils that are commonly used that have stimulating properties on the body. In addition, so within the plant, there are also flavonoids and other substances and phytols that are quite valuable to the body. We just haven't really drilled down into these biologic substances and the advantage. Now, the important thing, and I want to get across, is that entourage, that those extra substances are very valuable in terms of how the CBD is working within the body, because that's part of that entourage that makes the really good effects that come from it.
So yeah, we don't just want something in isolation completely. We want the other natural forming chemicals around it. I guess it's the same as when people say, eat real food, because there's a different effect when you have real food versus a supplement, for example. And you've just got me thinking there then. So when we try extract it, the CBD from a hemp plant, then we are drawing in all these other entourage chemicals with it, are we? It's not just CBD.
It depends on how the extraction goes. What the people that I've been working with, the Elixinol company, has been using a supercritical CO2 extraction. So they're using carbon dioxide as the solvent to pull out the cannabinoids and the phytols and the flavonoids that come from it. And that process gets the greatest and the fullest extraction of that entourage at the same time, whereas it doesn't contain any alcohol or toxic substances that are going to be irritating or cause any problem. It's also very healthy for the environment as well.
Okay, so that's the top tip there already, is look for CO2 extracted CBD oil. That's what people need to look for.
I think that's a key and important thing. But the other point that they need to look for is they need to look at the certificate of analysis that's done by a third party that examines exactly what is in the product that they're looking at. So you want to know certainly how much cannabidiol is there. You want to know if it contains any THC, which it should not. You want to look at perhaps some of the other cannabinoids that are present in it. You want to make sure it doesn't have any toxins or solvents or any biologic substance, so that it has bacteria in it, or heavy metals or pesticides. And that should all be available when you're looking for a product, so you know exactly what's in it, and then you're not going to cause additional damage as a result of it. I just want to go back to, I didn't talk about cannabidiol, the molecule. It's actually a small molecule. It's a small fat molecule. It's 22 carbons. And so it's not a whole lot different than some of the oils that we take in, like medium chain triglycerides or coconut oil. It's very similar. And the body processes it through this fat metabolism mechanism. And as a result of that, it's using a system that we haven't learned a whole lot about, but it is key and important to the body's overall function. In fact, some of the other molecules that you may be familiar with, like omega-3 fats that are DHA and EPA, are actually very, very similar to cannabidiol and some of the other cannabinoids.
So that's fascinating, where that I know that you're a fan of the low carb diets or the ketogenic diet, and that's another reason I wanted to get you on, because the reason I got interested in the keto world was because of seizure patients and going, wow, okay, so these fat molecules, these ketones, all these ketone bodies, they seem to be good for our neurology, for our brain. And what you're saying here is that the cannabinoids, they are sort of following the same pathways, and that's I'm going to get onto that later into our discussion about some of the common things to use the CBD oil in. But for seizure patients, so I want to delve deeper into sort of that field later on into the discussion for sure. But just pulling back into then, just to finish off with the quality aspect before we get into that. So taking hemp oil on its own is not the same as just taking CBD oil. So I guess, are you going to get a much smaller percentage of CBD in hemp oil if someone had to take it as a supplement, or is it, or the two the same?
Right. Just if it's considered, it's hard to say. Depending, it's what the manufacturer really wants it to be. So if it's just hemp oil, then it's not a whole lot different than olive oil. You have to look at the individual ingredients and the very, very low concentrations of any cannabinoids that are present in it. Lots of good things. There are some omega-3s, but it doesn't have a high concentration of any of the cannabinoids that are present in it. Now, oftentimes so you have to look very closely at the label, because some of the cannabidiol, the CBD products, are actually being labeled as hemp oil in order to probably get around restrictions and legislation and negative aspects that people associate with hemp, so that it's more easily available. And I can only explain it that way, because you have to look at the label to find out how much cannabidiol is actually located in the product.
Mm-hmm. Okay, so talking physiology stuff again. When I watched that documentary, I didn't realize that the human body makes cannabinoids. Sorry, I told you I was going to get tongue-tied on this one, but so if you could just explain that.
The body has its own system for handling cannabinoid-like molecules. It's incredible. This was discovered in 1992, and it's a comprehensive system. It appears to be a master controller for many of our other body systems, and we really weren't aware of it. Unfortunately, even though we have thousands of articles about this system, over 8,000 articles within PubMed on medical literature, we still don't have an awareness by physicians and by the general public about how comprehensive and how important the endocannabinoid system is in our lives. It controls and it regulates so many things: our appetite, our emotions. It handles the neurotransmitters, our immunologic system, and it's all regulated with a complex system that has its own synthetic material to create the cannabinoids, and it has the degradation. It also has transporter molecules, and it has a number of boosters that work within the synapses of the muscles or in the nerves in order to make the cannabinoids work differently. It's controlling the neurotransmitters. It's regulating the immune system. It's working on the hormones. And of all places, it's working on the gut. Fabulous in terms of regulation, normalizing the gut. When we fast, we turn off the endocannabinoid system in terms of that stimulation that may cause some disturbances. It's also working on cellular metabolism. It's actually shifting cellular metabolism in a very similar way as ketones do.
Okay, yeah. So we do produce them then. The body produces a natural amount on its own. And a good example for people to visualize that is in breast milk, apparently, that when the baby's feeding on it, and that's when they get that sort of breast milk high, when they're so happy afterwards and they unlatch, it's because the mother has given them a good dose.
Perfect example. And the endocannabinoid system controls the implantation of the egg in the uterus as well. So we're getting down to the very smallest fertilized egg and the impact of this endocannabinoid system. But we can get it into foods that we eat as well. And I'm not just talking about cannabis. I'm talking about chocolate and truffles, probably other foods as well. And it's found in flax. The flax cloth actually contains cannabidiol specifically and that improves healing if you use the flax cloth as a bandage.
Wow. Okay, I didn't know that's a flax cloth for bandaging. That would be quite novel. So we've got these receptors all over multiple systems in our body, as you said, the gut, the brain, the muscles, all over the place. And I do find it fascinating because when I studied physiology, this system was never brought up at all, which I find amazing because it is so influential, as you said. So I guess
what decade was that, Gary?
I graduated in 2004, so that was the early 2000s. So as you said, in 1992, I should have already been hearing about it, or at least reading about it in the physiology textbooks.
That's right. You should have, and you should be hearing about it now. But less than 5% of medical schools in the United States are teaching or informing any of the physicians or the medical students about it at all. In fact, most of the physicians that I talk to have no clue about the endocannabinoid system, and yet it's so highly regulatory as what we talked about, the neurotransmitters.
Yeah. And I think that comes back to why you're so excited about this whole system, because you have a substance now, or a range of substances that you can administer to a patient and get different physiological responses, I guess, out of them, which is what we're going to lead on to later in the discussion.
Right. And what turns out, Gary, is very interestingly, is that we can have an endocannabinoid deficiency. In fact, deficiencies of the balance of the receptors and the agonists have been found in almost all major diseases. So if we're talking about depression, anxiety, PTSD, different types of cancers, Crohn's disease, Huntington's disease, all of these diseases actually contain disturbances in the endocannabinoid system, whether it's low levels of an endocannabinoid as the agonist, or it's high numbers of receptors. Whatever the balance is, it's dysregulated. And the thought is that if we could rebalance that system, then we might be able to restore health to the body. Because the main purpose of the endocannabinoid system is just to maintain homeostasis, just to maintain normal, not to make you a Superman in any way.
And so, is there any risk of toxicity, like taking an overdose of CBD? Like I take too much and I get a negative side effect from it, or is the body just going to reject and eject sort of excess levels if I had to ingest it?
No, there is no toxicity. No person has ever died or been seriously injured as a result of using cannabidiol. Can you get side effects from it? They're rare and only at high doses. And yet, if you look at some of the human studies that were done, as much as 1,200 milligrams were used in adults with, for example, schizophrenia, and it had no significant adverse effects whatsoever, certainly no toxicity. It's potentially, it could interact with some other medications, going through some of the liver pathways, but I haven't actually seen that at the normal doses that I have been recommending for people. And I feel like I can use normal doses that are less than 200 milligrams of CBD when you use a high quality product that has a full entourage, a full spectrum within it, and not using isolate type of compounds.
So when you mentioned medications there, that would be one of my questions, because any listeners here who are taking it, or they might be taking other forms of supplements or medications potentially, are there any sort of common interactions that are known about, or that sort of hasn't been highlighted or studied as yet?
Well, there's been a lot of questions that I get about it. But if you look at the science on it, you find out that there is a relative interference through the liver's CYP or cytochrome 450 system for metabolizing drugs. And it has the potential of interfering, but only at high doses, well over 200 milligrams. That's when it starts to result in that. There's only been a couple drugs that have been identified as being changed as a result of using cannabidiol. most of those drugs have been associated with epilepsy. So you are using neurotransmitter modulator type of drug like clobazam, which is a common drug that's used for epilepsy. That can raise, using CBD and clobazam can either raise the level or decrease the level of clobazam. And it's true for some of the other anti-epileptic types of drugs. And it's also true for some of the neurotransmitter types of drugs that we use for schizophrenia and for Parkinson's disease. L-DOPA is essentially a neurotransmitter, dopamine substitute to give to people. If you combine that with CBD, you could potentiate at the neurotransmitter level. So there is some synergy that happens with it. On the other hand, there is some very positive interaction as a result of using CBD with some other drugs, like low-dose naltrexone. It actually amplifies the effects of in a complementary way, not to make it excessive, but complementary. Antidepressants, SSRI type of drugs for depression. It complements those particular drugs, although it's my firm belief that CBD can correct for depression in a very short order within a matter of days, and then the SSRIs don't need to be used at all.
Yeah, and that would be exciting again, just for patients here, because usually, again, especially if we're talking antidepressants, when someone gets put on them, they tend to get put on them for quite a while, not just a couple of days. So, and that's exciting for you to say, like, no, here's another substance.
Even more, Gary, and it takes as long as 6 weeks for an antidepressant to work, whereas I see changes in people immediately by taking CBD. They don't have to wait weeks. They can see it in the same day, changes in their mood, in their behavior, and their overall outlook on life.
Fantastic, and it's a natural substance again at the end of the day, which I like. And so just moving away from medications then, supplements, when we were talking earlier about MCTs and other sort of fat-soluble vitamins, would taking CBD with supplements enhance their bioavailability, do you think? So I'm just wondering, this endocannabinoid system, is it going to sort of wake up my cells that they're going to be more receptive, or sort of, I'm just wondering, is there going to be a synergy by taking this in combination with other supplements, for example?
I think CBD is essential that you're taking in omega-3s. Omega-3s are are incorporated in the endocannabinoid system. They're modified, and that's what their real benefit is. And so combining them is really important. But the two work synergistically and getting better effects. In other types of supplements, I think it's important that we supplement with vitamin D3 because we're just not getting the amount of sunshine that we need to. The other is iodine. We need to be taking that in. A popular culinary approach is to take salt and not include the iodine for taste factors. But if we're not getting iodine from some source, like kelp or seaweed, then we're really missing on the essential need for iodine within our bodies. It does appear to complement in some diets, particularly a ketogenic diet, because it looks like the two mechanisms seem to overlap and to amplify the benefits from both of those processes right down to the level of the mitochondria and shifting the metabolism in the mitochondria, making it more efficient and less reactive oxygen species that will cause inflammation.
So your top tip earlier was taking a fish oil, a good omega-3 oil with your CBD, because those two seem to work very well together. But since you brought up the ketogenic diet and working together, that sort of takes me into the concept that CBD oil has made the headlines, particularly recently in the UK, with a mother who had I don't know if it was just CBD or it may have been CBD plus THC. I'm not aware, but she had the government basically confiscate it from her at the airport, and her son required it to stop his seizures, and it made the headline news and everything here. But when I did my geeking out and research about it, I was just blown away, like how effective it is for seizure control. I mean, children who are seizuring every 20 to 30 minutes, you give them this oil and suddenly they can become seizure free. It's incredible. And that, and that's why I got interested in the ketogenic diet too, about seizure control. So I guess my first question is that, as you said, about the synergy between the two, do you think there is a neurological, like a brain benefit, if someone was using a ketogenic diet to have better neurology, better brain health, and taking CBD, like the two together, the ketones plus the CBD are going to just really help heal your brain?
Well, I do. I think there's pretty good evidence for it. We know that the ketogenic diet has been used for centuries, and we just haven't recognized it. The number one has been talked about for weight loss in the mid 1800s, but it's also been very effective for diabetes, epilepsy, as we talked about. But there's also evidence for multiple sclerosis, and Alzheimer's disease and autism. All of these conditions respond to a high-fat type of diet, low carbohydrate. It turns out that when we make ketones, we actually signal the body in certain ways. We reduce inflammation. The signaling of ketones goes right down to the mitochondrial level and to the DNA, and modulating an epigenetic changes to the DNA to shift it to an anti-inflammatory manifestation within the body, within the brain. It does seem to improve functioning of the brain, as I mentioned, with MS and Alzheimer's and autism. And it's using some rather unique pathways. And it turns out that CBD is actually working on some of those same pathways. So you really are amplifying the maximum benefits that really affect the cognizance, the clarity of both the thought process, as well as what I've seen is actual visual improvements that go along with cannabidiol.
Yeah. And so, I was talking the extreme cases, like I watched in the TED Talks with the seizure control, but, I think there are going to be a group of people who are on a low carb or ketogenic diet for just general preventing brain fog and just general well-being and that cognition effect. I want to think well as I get older too and protect my brain health. And so you're saying that here you think it would be good to sort of take like a maintenance dose of CBD oil if you want to also protect your brain for the long term.
I do. I think it's essential for diabetics too. But we have inflammation in our body that gets turned on and doesn't turn off. We've got to control that inflammation. Otherwise, we lead to things like Alzheimer's and dementia, or Parkinson's disease, or diabetes, worsening diabetes, or kidney disease and eye disease. All of these things have a basis as inflammation within the body. Using CBD could downregulate the inflammatory, the immune system, such that we don't face those complications. A classic is atherosclerosis. That is inflammation within the blood vessels and around the blood vessels. If we could stop that process, based on what I've read and have looked at, the CBD could stop that particular process and block atherosclerosis in the body and prevent heart attacks, as well as preventing stroke.
Okay, so the main mechanism here that people will be benefiting from sounds like all these receptors are getting stimulated by taking the CBD oil, and it's this massive body-wide anti-inflammatory effect that's going from your blood vessels, near your heart to the back of your eye to in your muscle. And that, I guess, that comes into where the reported benefits of it is for things like pain control and joint pains too, because it's that anti-inflammatory effect.
Well, that's part of it, but it's also the neurotransmitters. We have a mechanism where we respond to a stimulus of some sort. We release neurotransmitters. The cannabinoid, the natural endocannabinoid receptors are there that actually signal the cell that is releasing the neurotransmitter to signal it to turn down the volume, decrease the amount. And it's called retrograde type of stimulation and modulation. So it turns down the amount of neurotransmitters that are being produced, and it reduces that the height and the intensity that's going on. So it regulates, and it's supposed to modulate the body in a proper way. And I want to just go back to something you said, that you talked about stimulating the body. It's not always stimulation. Sometimes it's blocking. It's quite a concert in terms of stimulating on this side and depressing some other areas. And so that's why I like to use the term modulation. And so if you've got the endocannabinoid system being modulated and regulated, then you can get closer to homeostasis and get away from these extreme cases where you have inflammation or you have irritation. And you brought up a really good point about pain. So particularly pain, there's really two components. You have the analgesic effect. So that's neurotransmitters that are going on. But you also have the inflammatory phase, where you have macrophages that are going into an area that are releasing cytotoxins or cytokines that are irritating and promote inflammation. So CBD is actually working on both those lines. Number one, you get that analgesic effect at the neurotransmitter level. And then after a couple of days, you're really moving into the anti-inflammatory area, so that you're going to stop the inflammation that's going to lead to disease progression, fibrosis, and other damage to the organs.
Yeah, and so that's more at the site of damage. So if you cut yourself at that area, there's a whole lot of chemical activity going on, like a chemical soup.
Exactly.
And I did read, I believe, there was a study that was even looking at sciatica. So this is now your nerve pathways from your spinal cord down the root. And even in those cases, there was a benefit from if I think I did read that properly, but that would also be amazing, that we're looking at like central pain pathways. So within the spinal cord and the neurology, is that being studied? I don't know if that is true, what I read, or.
Well, it's being studied, but unfortunately, there are issues with getting the studies done in humans, and many of the review boards have not allowed human studies, and we're having difficulty getting particular products. It's being looked at. It's been looked at in animals, and there's a lot of what we call preclinical studies, but there's not very many that are going on in humans. Everybody's waiting for a pharmaceutical product to be produced, but typically pharmaceutical products are isolates. They're dealing with just cannabidiol, and as we talked about before, you really need a full spectrum in order to get the balance that you would like to have and the enhancement from the other substances that are located with the cannabidiol.
Mm. And when you were mentioning earlier that when you ingest it, it's going to stimulate or raise the activity of certain chemicals, but your body's also going to potentially use it to dampen or quiet down certain chemicals. And that's just amazing to hear again, that so we're taking this substance in and it is helping regulate, it's helping that homeostasis, that balance, that fine balance the body is always trying to do. And again, just to think it's doing that over many systems, cardiovascular system, hormone system, gut system, so many systems where it's trying to allow the body to go, oh, right, okay, I'm making too much of this, or no, I need to make more of this. And
at the tissue level, right down to the cellular level. So for instance, CBD is an excellent anti-inflammatory. Great, a terrific anti-inflammatory, and it'll protect the normal cell from damage as a result of toxins, of heavy metals, or from injury from chemicals. But at the same time, if we're dealing with certain types of cells, like cancer cells, it kills and it promotes the death of cancer cells. An amazing intelligence. Some people call it an adaptogen, something that adapts to the particular situation and institutes the right kind of response that we need for homeostasis, maintaining balance in the body and maintaining health.
Yeah, and when I watched that documentary I mentioned earlier, The Scientist, there was one study was brought up there about how effective it was for children who were undergoing cancer treatment, and they just didn't have the massive negative side effects. So in that case, the oncologist, the cancer doctor, was giving them CBD oil, and she knew which was placebo or not, is what they said in the documentary, because she knew, like, oh wow, this group is just not vomiting and they're not going through all these terrible side effects, but this group still is. So she said she knew immediately which group was taking CBD, so it wasn't completely like randomized double blind.
But it's much more than just controlling the symptoms. What I've seen in a number of patients is an enhancement of the killing effects of the chemotherapy along with the CBD, as well as protecting the normal tissues. I've had dozens of patients with cancer using cannabidiol. I really promote people using it during the time they have chemo or radiation, because it's going to protect the normal tissues against those side effects, but also the tissue, the normal tissue. And it's going to enhance the killing effect of the cancer, out of the chemotherapy on the cancer cells.
So is it accepted by oncologists? Are they either recommending it or they're happy for patients to take CBD oil?
I don't know of any who are recommending or using. I'm trying to get my foot in the door and talk with them about my experience, but so often they're looking for double-blind controlled studies which are very hard to produce and really require a pharmaceutical company with the deep pockets in order to do the kind of studies that they would be looking for. On the other hand, I talk to patients and I try to empower them with the understanding that these substances are food products, and that they're safe. They're not toxic. They don't have any significant adverse effects to them. So that if they're taking a food, nobody's really going to object to the food result of using a food. And try to empower patients so that they are doing the research, finding out for themselves, and maybe definitely bring it up with their doctor, but not succumbing to the negative information that might come from a lot of physicians, particularly even in the oncology area, unless they feel that there is some sort of possible interaction. But even then, I've not seen a negative interaction with oncology and with the chemo and radiation therapy that of any concern. And on the other hand, I've seen some great remissions, people doing very, very well, recovering and maintaining remission for a number of years.
Well, any patients who are a little bit concerned with cancer patients, I guess they can maybe somehow contact you just to find out for some more information, because, it's people, then that's why I wanted to interview you. It's people like yourself that help to educate listeners and to educate people who are on a hunt. They're on their own N=1 sort of research discovery of what they want to do with their own body and their own health. So we've talked about seizures, we've talked about cancer. I mean, these are all big medical events too, and that another common one which you already touched on earlier was the SSRIs, the antidepressant drugs. So I see another common form that why people want to take it is for anxiety and depression, and you would say that it is good if you're prone to those symptoms, then a dose of CBD oil will be a part of your journey to help you recover.
Oh, absolutely. I love to talk to people with anxiety because in 95% of the time, I can control it and regulate it, or they can, using cannabidiol. And it happens immediately. Then they don't have to wait a while. And they can get away from the benzodiazepines, the Valium type of drugs that people are using that can be addictive and can have some significant side effects with it. So using the CBD, you have to adjust it according to your particular need. But like with the product that you're using, you probably need to adjust it according to your symptoms. And then what I tell people is to titrate it, or just increase or decrease the dose according to how you respond with it. There's no toxic dose. You can take as much as you want. It is a food product primarily. So use what you need to control your symptoms and conserve where you want to conserve for expense-wise, and know that there are long-term benefits, not only the immediate, but there are long-term benefits that are going to happen physiologically within your whole body.
And yeah, we haven't got into the dosage stuff. I do want to get into that because, whenever it comes to a natural substance, I always try to think of what is the clinical dosage that's needed. If I'm a big guy versus a small lady, do we need different dosages or different situations, as you meant, and how we respond to it? So, what for the extreme cases, I'm calling them extreme, but for these children that were having these multiple seizures in a day, what kind of dosage level are we talking about there?
So for kids and for seizures, I have a general guideline of about 1 milligram per kilogram. And this is a bit of the exception. I usually don't go by the kilogram weight because everybody has a different level of endocannabinoid deficiency. And if they're deficient, if we can replace that or modify that, then they'll get back to normal. However, in this particular area, it's really common to use the per kilogram. So for most kids, even adults, 1 milligram per kilogram is a great area, great target for a therapeutic dose that I find 70% of people do respond to. Some respond less than that. Some require higher levels of it. In certain types of syndrome, they may require as many as 10 milligrams per kilogram. But those are exceptional, and I have only run across those on rare occasions. And so it's not very, very prevalent. But for everybody, I want them to start with, and I recommend they start with the standard serving, whatever's on the bottle, and then but double the dose if they're not feeling like they're getting control of their particular symptoms. And then double it again until they find a therapeutic dose that makes them, that they can feel, that they feel some of the changes. So the changes like a relaxation over the face and the muscles of the face, a relaxation of the voice where the voice will drop down an octave. They might start talking faster. They'll show some humor and conversation. They'll be more socially inclined. There'll be a rising energy that they'll have as well. So a lot of and there's also the analgesic effect. If they're in pain, you'll see a diminishment of the pain to some degree. I also like to have them check their vision because consistently I see an initial and dramatic effect with a sharpening, an improvement, and a clarity of the vision as they're viewing distant objects. So looking at trees and leaves in some distance out a window, the colors seem to pop. They go into more detail with it. And there's not only a clarity of vision, there's a clarity of thought where their memories improve, they sharpen, their thoughts are quicker. And physiologically, we also see changes in performance where they're able to tolerate anaerobic type of exercise much greater, able to hold their breath for a longer period of time, and diminish any type of soreness that they have from working out.
Yeah. So I listened to one of your previous podcast episodes, and you brought up the vision aspect of that too. And I've only been taking my CBD oil for 7-10 days. It's not really that long, but the vision thing, I actually think there's something to it. I mean, I've been looking into the distance, over the summer now. I live near the sea, and I do notice that the mountain range across the ocean from us looks clearer. And when I look at the fields and the animals in the fields, there's something to it. And I think you're definitely onto something there, where you're saying that it has a vision component to it. So even if anything, and if you've got some visual issues, why not just give it a try? Just see what it does.
So you actually, I call it the high definition mode. So you go into HD into your visual. Now it doesn't last necessarily for all day, but you do see some improvements.
Periods.
And I've had to caution people about correcting their lenses, changing their glasses while they're on CBD, because actually they tend to have to go backwards to their previous prescription because their eyes have improved.
Yeah, again, just to think, because your eyes are an extension of your brain. And so here's the substance again that's helping the neurology, the brain, the retina, whatever is happening in there from this chemical effect, this endocannabinoid system. I just find that fascinating. We want good visual health. So if you've got good visual health, it's doing something to the neurology. And I just love that idea. So
what about sleep? How have you done with sleep? Have you noticed an improved sleep quality?
Yeah, I would say I wear the Aura ring for tracking, and I would say my REM is definitely better. And less turning at night too. So I've got 2 young kids, and they do wake me up very early because they like to wake up early with a light. But no, looking at that, I would say too, a more peaceful sleep. So less sort of wakefulness during sleep and more REM are the 2 big things I think.
Exactly what people report to me consistently. Now, it doesn't put you to sleep. In fact, there's another one of these paradoxes, is that it can actually wake you up. If you take it, when you take it, you can actually get stimulated so that you're alert, your mind is going and moving. But then it also improves your sleep. So it's quite a paradox. I ask people not to take it right before sleep, within 2 hours, because it can have that activating effect and maybe stimulate them so that they don't sleep. Another thing, have you noticed vivid dreams? This is a common effect of CBD.
Yeah, and I think that comes into that REM component. My dreams are pretty good. I'm normally a good dreamer too, so hard to say if that's different, but the data is showing that REM's looking good. So no, sleep quality. I'm not normally a bad sleeper, but there's definitely something to it there too. And I feel good in it. I'm so new to it, but that's what I'm so excited about the stuff too, just as you are. I don't know. It's in 7 to 10 days, I think I can feel quite a nice difference in my body, and it's not an extreme change either. It's just this good feeling, and
you're just getting back to normal. I mean, you get to be all that you can be, and your relationships with your wife and your children are really positive. You're not blowing up. You don't have the tenseness that goes on. You're conversing. You want to talk to people. You want to interact with people. Very, very positive events that are happening. You're just being human. And what about empathy? Have you noticed yourself being particularly empathetic for people who are suffering or having difficulty?
Yeah, I'm normally empathetic because that's just my nature. But what I would say is that. So I did a neurofeedback training experiment earlier this year too, and so there I was also learning about meditation and trying to put yourself in that better place, the empathy place and the gratitude place. And so with meditation, you're always trying to train to sort of be aware and know when you're in that place. And I would say the CBD oil enhances that practice. So I would see a benefit of adding CBD oil with your meditative practice, or if you were going through a neurofeedback training protocol where you had the EEG on your head, it would help enhance your neurology. I'm seeing the benefits here to that effect. I
completely agree. I'd like to see more some studies done on it, and like to hear more reports like yours, because I feel very positive about it. It could make a big difference for people. People who also with post-traumatic stress disorder have a lot of behavioral disturbances that go on, and CBD used at the same time of those experiences could block many of the adverse effects that come along with PTSD. It actually blocks this reconsolidation phase that's involved with this broken record effect of remembering these ill experiences. So at the same time, people with PTSD can't forget. They have a broken mechanism for extinguishing bad feelings. And with CBD, that opens it up. And so combining CBD with a therapeutic engagement and reliving those experiences could dampen that, block those PTSD effects, and actually put these people into remission.
And so with your background in the Army, PTSD is a big thing. And I mean, you've served in wars too. So I don't know if you're allowed to say, but is the US Army experimenting with CBD to help veterans?
Oh, they've been experimenting for PTSD in a number of different ways, but there is some limited studies that have been allowed by some of the universities on the East Coast, particularly, I believe, University of Pennsylvania is doing some studies on it. But there are not real vigorous studies going on, and they look like they'll be years before they'll be able to be used in some way. On the other hand, I've got my own study that I'm doing for veterans in my area, and we're using CBD, and we're finding those particular benefits that I talked about, where people are able to get their PTSD under major control in very short period of time, a couple weeks, and actually put them into remission so that they're more functional in their society and their interactions, and they're healthy all the way around.
So, with your interest in the ketogenic diet too, have you ever seen anyone take an exogenous ketone, a salt or an ester, and take CBD oil? It's like, I'm just wondering if you can take an exogenous ketone and take CBD and get a little boost of some sort.
Well, I think you can. Nothing elaborate, but looking at MCT. So most of the exogenous ketones are usually from maybe an MCT derivative, and that can be used. So you're using some shorter chains or some saturated fats. That enhances the absorption through the gut. It goes into the lymphatic systems, and as you know, the lymphatic system doesn't go first pass through the liver, so you avoid the first pass effect. There's less degradation of CBD in that particular process. But you're also providing the building blocks for ketones, and you've got that particular benefit on what's called there are nuclear receptors called the PPAR receptors, and the ketones are working on those and developing ketones from using the MCT, along with using CBD, which is also going to activate and stimulate these PPAR receptors, slightly different variation, but they're both working on that nuclear component, making epigenetic changes that really enhance metabolism and cell function while reducing inflammation.
And then with people who are doing fasting for autophagy, for cellular cleaning, would you recommend they take CBD during fasting, even though it might break a fast? I don't know. Or would they take it after fasting?
Well, I think it actually is enhanced. The CBD effects are quite enhanced with fasting. The CBD mechanisms seem to improve. I notice that when I'm fasting, there seem to be accentuated in terms of the particular benefits. So lower doses are needed. You're getting, when you go into a fasting state, there's actually a kind of a high that you get with fasting. A change in your metabolism and the speed of your brain processing and function, probably related to some of the ketones that are going on, but overall functioning. And there's a dampening of the endocannabinoid system in the gut and in the brain, so that everything's working in a very effective way, in an efficient way. And so combining those two does seem to show an enhancement and a sensitivity, and so could be a major benefit. And then adding some exogenous ketones or saturated fats could have the advantage of making that even more effective with the endocannabinoid system and using cannabidiol.
So what are your recommendations? When are the best times to take it? Should I take it with a fatty meal, or before a fatty meal, or after a fatty meal? It sounds like having some sort of fat is going to help with the absorption level better.
Exactly. I believe that it should be taken with fat. A saturated fat may be best. So you get something like in butter or cream, and then but it also could come from MCT oil. You're going to get an effective, more effective absorption. You don't have to take a lot. Just perhaps a tablespoon is all that might be needed in order to stimulate that improved absorption pathway. And that, I don't tell people that it needs to be taken at a very specific time or in a very specific schedule. I think, practically speaking, I like to help have my patients kind of figure out what's best for them, what fits within their lifestyle. If they have to go to school and they're away, then they're going to be taking it when they have a chance to. And I also want them to, as a food product, to take it as often as they need to control their symptoms, rather than sticking to a rigid schedule. So getting away from the idea that this is a pharmaceutical drug that needs to be taken on a specific schedule, and then combining it with fat, some saturated fat or some fat with a small meal. But don't take it with a large meal. unfortunately, with the relaxation that occurs with that, it can sometimes relax the esophageal sphincter that could allow for a little bit of reflux during that mealtime.
Okay. Yeah. Well, I've just experimented a little bit and just anecdotal stuff, but taking it just before having some good coffee seems to make the coffee feel nicer too. So I don't.
I think it combines with the caffeine, and it's working and amplifying the hormonal effects and the neurotransmitter effects that caffeine stimulate.
So when I was looking at all the different products available, a lot of it looks at percentages. Like I've got a 3% substance, and luckily it's CO2 extracted too. But could you just explain then, as a consumer, what should I be looking for if I just want, say, general health? Is 3% enough, or should I have a 5% and 8%? How do I know which percentage I should aim for?
I just focus, because all the products are different, they're packaged different. You've got to do calculations to figure out how many milligrams of CBD. So generally, I'm looking at the number of milligrams of CBD and counting those. And so, but it does make a difference in terms of the product, because some of it is more bioavailable than others. For instance, the Elixinol liposome product is structured so that it has an improved bioavailability that may be as much as 5 or 7 times what you might find in an oil tincture. And so you have to consider that. So you start with the serving size that is recommended on there, but double and triple in order to get the effect on the control of your particular symptoms. You should get those effects and those benefits right away. So if you're not getting those benefits, you're not seeing any changes in yourself, then you've got to increase the dose, or you may need to find another product.
And from what I understand, it seems the best way is sublingual, so underneath your tongue.
Yeah, you get immediate effects by doing it that way. I say it is probably the most effective through the oral route. You get really good absorption through the mucous membranes. And then the gut is sort of second. But this can also be vaporized, and the vaporizing delivers 95% efficiency in vaporizing it. There are capsules available, and they take a little bit of time, take a couple hours before you feel the effects of those particular capsules. And then there's different forms that you may be using a tincture of some sort that's mixed in with another oil, whether it's olive oil or MCT oil.
MCT, yeah, that's what's on the bottle here.
Well, one other way you can use it is topically. And I frequently encounter people who have an injury, a burn, or a laceration, or a painful area, and I have them rub it right into that area of pain and get relief within a few minutes.
Yeah, well, I actually have been doing that, where I have a little mark on my skin here, and after I've sprayed, there's a little bit of residue, and I just take that and I've rubbed it, and I've noticed a change. That was random. I was speaking with my wife today about that, and she's like, "Are you really seeing something? I don't know. You just, you talk about your vision thing, and now your skin, and
that's the most common thing that I get feedback is they say, is this placebo effect? You told me I might feel something like this. I think it's placebo. It's just my imagination that these things are getting better. I don't completely understand that. When you have symptoms before and then they go away after you take this food, then why wouldn't you attribute it to the food? But more often I get placebo, that I've hypnotized them into thinking that they've made these improvements.
So, well, it's good to know then. So just coming back to understanding with the dosage wise, that, yeah, I can play with the different dosages. There's no problems. I mean, when the biggest dosage I think I saw, does it go up to something like 20% or 40% a tincture? I mean, are those only really used for those seizure patients, those cancer patients? Is that what they need to take?
Well, there are some, but I don't recommend high doses of CBD for cancer patients. And the epilepsy, there are a few that have to take some high concentration, but I always recommend a full spectrum product. And you don't usually get the full spectrum in those really, really concentrated products. So I'm not enthusiastic about that. And that's so rare. I don't see those cases very often, and but I do just continue to adjust the dosage and maybe use some complements to the endocannabinoid system, like the omega-3s, or maybe some of the other cannabinoids that are available, like beta-caryophyllene. and which is actually, it comes from broccoli extracts. Correction, that actually comes from hops and basil and oregano. So it's one of those oils that we get in a lot of the food stuff. Now, in the study that I'm doing here, we're combining it with whole body vibration so that it's a exercise stimulation that also goes into it. So as part of the improvement of the individual, they need to be considering all those healthy aspects like exercise, diet, sleep quality, meditation, all those things that we've known about, and a good healthy diet. Hopefully incline people towards a ketogenic diet, but people have also had great success using a vegetarian diet that excludes modified products that are have been adjusted or fabricated in some way.
Mm-hmm. So it's good to know then. So it doesn't mean the stronger the dose that a company might sell, the better it's going to be for an individual for general health. You don't have to think like that. You can go for those lower percentages and as you said, just adjust and titrate and just see how you respond and how you feel for whatever you're achieving. So the last one I want to ask about is just diabetes then, because that does seem quite exciting. I mean, I've had a lot of guests on the show who've talked about about insulin resistance and diabetic control in that. And so how does a CBD oil help someone who's got, say, type 2 diabetes, or my question was even type 1 diabetes. I was asking some type 1 diabetes patients, like with this insulin resistance, do you know anyone who's taking CBD oil who's doing like a continuous glucose monitor check or something? That what does it actually do to their body?
Well, I do know. I have an 8-year-old child who's using CBD, and he has had some dramatic improvement. His blood sugars have dropped 30 points. He's gaining weight after being depleted. He has type 1, but he's in the honeymoon phase, meaning that he still has some insulin production. And he's been able to cut out his long-acting insulin, and he just uses short-acting insulin along with a ketogenic diet. Because diabetes is a carbohydrate disease, and you got to stop the carbohydrates in order to control the diabetes. Now, obviously, if you're taking insulin, you're going to have to be careful about that. But any diabetic, whether it's type 1 or type 2, should be reducing the carbohydrates to the lowest level. CBD acts as to improve the signaling within the body and reduce the inflammation and protect different cell types against damage from elevated glucose. So it's protecting the eyes, it's kidneys, the liver, and the brain. All of those areas are being protected, whereas it's also shifting the metabolism so that there are actually more glucose receptors on the muscles that are active and taking up more glucose and leaving less behind inside the bloodstream. There's a number of protective factors that go into this. I mean, I think that they are going to be enough to reduce the complications of diabetes that we would normally see, even including atherosclerosis.
And you touched on it earlier about the research component, and it's not really being tested in humans. Is this more the legality issue that in different countries that cannabis itself, even if it's hemp or marijuana, is being blocked at a legislative level? That's the reason these human studies aren't being conducted?
Well, in the United States, it's actually being blocked at the administrative level. The current administration is blocking the law, actually blocking the laws that and attempts to legalize the use of hemp and hemp products that have come from the Congress. Congress has actually passed 2 laws that said basically you can use industrial hemp with very low amounts of THC for whatever you want to use it for. And the Department of Drug Enforcement Agency is blocking that and reinterpreting the legislature law. Now, they're not supposed to do that, but that's what's happening at the present time. And the DEA is insisting that Congress be more specific in their laws. And congressmen have written the DEA, said, my goodness, we have told you very specifically, we don't understand. So there's barriers that are within the administration. It's less so within the legislature. It's just getting those 2 areas to understand the huge potential benefits for helping patients as well as the financial savings. Because if we substitute cannabidiol for a lot of our healthcare problems, we would be able to take care of the opioid epidemic. We'd be able to solve Alzheimer's disease and dementia. We'd be able to preserve lives from traumatic brain injury, get people back to work and functioning for PTSD, and a host of other problems.
Yeah, well, I think anyone who's been listening up to this point, hopefully they're excited about it as we are. And I would suggest to anyone listening to this, try it out, see how it goes. I've had a very positive experience so far. The information you've shared, Dr. Blair, has been amazing. That the documentary, I'm going to share it in the show notes too. It's just mind-opening to say that, yeah, this is a safe substance. It's not something that's going to make you high, and there only seems a positive, which it's like it's a no-brainer in a sense. Just try it out, see. It's not going to do you any harm. So just coming to the end of our conversation there, what are the best ways that people can follow you, keep up with the information that you shared? Do you have any specific links you'd like to share for listeners at this stage?
Well, I'm on YouTube, and I've got quite a number of lectures, 40 lectures that are being discussed. I'm certainly on Facebook, and I do postings occasionally. There's a number of followers in that area. In addition, I do interviews and podcasts with people like you, Gary, and I'm always trying to get the word out. I also go to a number of different conferences and talk to people, and I take consultations. And somebody wants to do a consultation, if they go through the Elixinol company, then I'm a medical advisor for them, and they can actually engage me for a few minutes and a dialogue to get a protocol that they might want to be using. And that's the Elixinol company is ELIXINOL.com. And there's a UK version, so they're active in the UK as well as South Africa. So those are places that go. And I have my own website, but it has some limited information on it at Dr. Blair MD at iCloud.com. And then probably if you want to find out more about cannabidiol, one of the best sources that I recommend for people is projectcbd.org. It's important that you have the org and not the .com in that.
Okay, fantastic. And again, I'll link to all of those resources in the show notes for listeners. Just want to say, Dr. Blair, thank you so much for the information you shared today. I've been enlightened a lot. I feel I've learned a lot. I understand more about the product, and I look forward to just seeing what else it can do for me.
Terrific. It's been a pleasure to be talking with you about this amazing substance.